My name is Michael Meyer-Hermann. I head the Department for Systems Immunology at the Helmholtz Center for Infection Research, and I'm also a member of the Directors Board of the Braunschweig Integrated Center for Systems Biology. Our research is very much focused on host-pathogen interaction, and with the help of mathematical models, we describe those interactions. So how is the pathogen invading the host, and how is the host responding with immune responses? Those dynamics are extremely exciting because you can have totally different outcomes, namely an acute infection that is cleared versus a chronic infection that is persisting. We have a lot of patient data from the clusters, so we are in interaction with medical doctors who have direct access to patient data. So our models are not models that are just out of the sky, but they are real-world models that can be validated with the data so that we can also improve our predictions and the interpretations of the data and how we can make the treatment of the patients better. It is fascinating to see that a little parameter that seems not very important to a wet lab scientist may make the decision about whether the infection that a host is just catching will be an acute one and will be cleared in the end, or whether it will become a chronic infection that is leading to long-term sufferers. For example, we have analyzed hepatitis B together with Markus Kornberg at MHH and have found a specific set of cytokines that are important in order to understand whether patients will relapse or not. And so here we can see that the mathematical models are able to show which factors are actually important in order to see which patient needs which treatment. It is extremely exciting that we can describe nature and infections and the host response by mathematical models. And if we do so, we can find parameters that are very sensitive to the fate of the patient and also of the infection. So a little difference in one parameter can totally change the fate and the development of the infection. And to see that and to identify those parameters is extremely exciting.